Our case is about premenstrual dysphoric disorder. This is a relatively new addition to the diagnostic system for the psychiatry. It refers to a cluster of symptoms that occur in the last week before the onset of a woman's period. Premenstrual dysphoric causes problems severe enough to interfere with the ability of a woman to work on it, to interact
So
with
this is
others.
the case of patient Janet who is experiencing premenstrual dysphoric disorder. So in this video, you will see the conversation between an RPN, registered psychiatric nurse, and the patient.
Good morning, Miss Janet.
Good morning.
What brought you to our clinic today?
I think I have some problems. I have these unusual feelings I'm experiencing for about a week now.
Oh, can you tell me more about these feelings?
I have difficulty concentrating on what I'm doing most of the time. I get easily irritated and I have mood swings, and I think it becomes worsened. Sometimes that I feel depressed, anxious, and feeling overwhelmed.
When does this symptom started?
It's just like a week, about a week now. I also having I eat also a lot for these past few weeks. I slept a lot. I feel bloated.
Oh,
I even gain weight.
I see. So does these symptoms ever go away?
Yeah. I think during my menstruation, when my menstruation started, it
goes
disappeared.
away.
Yeah.
Okay. You have a classic sign of our premenstrual, we call it premenstrual dysphoric disorder.
What's that?
It
What is that? Premenstrual dysphoric
Yes,
disorder?
it's called premenstrual dysphoric disorder. It usually symptoms that you experience, like your PMS symptoms, but it's longer than your regular premenstrual symptoms, and it lasts usually for a week, and it usually goes away once your menstruation started.
So what I
There
have to
are
do?
there are things that you can do. Let's start first with something that's not invasive or something that's not pharmacological in nature. So let's usually patients that have this, we would always recommend regular exercises, usually aerobics exercises, because when you do exercise, it improves your happy hormone. Your body tends to produce those dopamines and your serotonins, happy hormones, we call it. And we also partner that with good eating habits. So we usually recommend to eat, for patients to eat food that are rich in complex carbohydrates. Usually these are your yams, your whole wheat bread, your sweet potatoes, and your brown rice.
So I must stop eating white rice.
Yes, if you could. And it's also good for you, right? And it is also important to get good night sleep. So rest, enough sleep, sufficient sleep, because usually if you are well rested, your body also feel refreshed the next day.
I
Some
slept a lot already.
you slept a lot, but the thing is you overdo it. So we don't want you to overdo it. We want your, we call it circadian rhythm, to be normal again. And yeah, oversleeping is not really normal, right? And we also do relaxation therapy. We suggest to patient relaxation therapy, light therapy. These are, we can provide you with brochures on the different kinds of therapies that might help you. And also, now if you do all this non-invasive thing and still your symptoms, you still experience the same symptoms, there are some medications that the doctor can prescribe you, and this will also help diminish the symptoms. We always suggest the first, you usually give you first those, we call it selective serotonin reuptake inhibitors. These are pills that can help diminish those symptoms. Now, usually there are different kinds, different brands, so the doctor is going to give you which one that is most appropriate to you. Here in Canada, we usually give this combination medication or combination of drospirenone and ethinyl estradiol contraceptive, and the brand name is Yaz. But all of this medication, it's your doctor who will prescribe it to you.
I hope I cannot go with that.
First with the non-invasive, I think that's the best way to go.
So after seeing the video, what have you learned about PDD? It is very important for us to learn the important cues in diagnosing persons with PDD. Patient Janet was experiencing symptoms like mood swings, irritability, depression, anxiety, difficulty. So these symptoms may decrease or disappear significantly with the onset of menstruation. If you also have noticed, Nurse Jean did the talk therapy and included some recommendations like eating foods rich in complex carbohydrates, getting sufficient sleep, light therapy, engaging into acupuncture, and some medications include the SSRI like Prozac and Zoloft. Diuretics may also be given to reduce bloating and weight gain if there is water retention. That's 5 minutes! See you later!